How did that feel?
Amazing. I feel a couple inches taller already.
Now you felt that go from that, like I said, that upper cervical just going
Yeah,
all
I felt it all the way down. Definitely feels life-changing already.
Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. Now you're currently over at Clemson, correct?
Yes, sir.
And you're a wrestler and a gamer as well.
Yes, sir.
Alright, so not only a student studying hard, and I mean I could just imagine with, obviously an amazing school like that, between homework and then wrestling and then, school, games, studying, yes, any and every student just, you definitely need adjustment. I guarantee you, even before I do anything, I already know that there's going to be things going wrong with you. But so as I was reading through the paperwork that you filled out, so I'm seeing that everything is stemming from basically headaches, kind of just going to mid-back.
Yes, sir.
So you've been, as you wrote down, you're getting headaches about 1 to 2 times a week?
Yes, sir.
Okay. And then, so it's neck pain, upper back pain, mid-back pain, correct?
Correct.
Okay. How long has this been going on for?
I would say probably for the last couple months, it's just been kind of intermittent on the amount of pain I have.
Okay. So just kind of depending on different activities, stress levels, things like that. But it's always just right into here.
Always upper region.
Okay. Usually nothing lower. Okay. Well, we will be doing full body examination. We're going to check everything. So obviously a good thing on why you're here today. So what we're going to do, I first want to kind of get a baseline, see where you're at. So I just want to go through some ranges of motion. Okay. I'm going to have you just look all the way up to the ceiling for me. Any pain, any issues with that?
No pain.
Look straight down to the ground. Any issues with that?
No.
Okay. If you were to bring one ear to the shoulder or then to the other, any issues with that?
No.
Okay. If you're able to look over either shoulder, any pains with that?
No.
Okay, good. So I'm going to have you sit up nice and straight for me. Good. Alright, I'm going to push down on the top of your head. Any pain with that?
No pain.
Good. I'm going to have you turn to one side here. Any pain with that?
No pain.
Good. And to the other side. Any pain with that?
No, sir.
Good. Alrighty. So right now, everything that you're saying is really all centrally located. Does anything ever travel into the arms, anything like that?
No.
Okay, it's just all right in through here going up, correct?
Yes, sir.
Okay. So, let's go ahead. What I want to do, I'm going to have you lay face down for me. Good. And then I'll have you just place your hands, right there for me. Alright, so what we are going to do, we're going to scan the entire body. We're going to check for that symmetry. What we notice on the right side or one side, we want the same on that other side. I'll be going through feeling the tonicity in the muscles. If I feel any taut, tender fibers, anything like that. I'm really going to scan the entire back and really see if there's any differences compared to either side. So, let's go ahead and get started. Now, let me know if any of this is painful to the touch while I palpate or do anything. Just let me know, okay?
Yes, sir.
Alright, so we're going to start in that upper cervical spine. Any pain or tension with this?
No, sir.
Good. We're going to come to that cervical spine. Any issues with any of this?
No, sir.
Good. Okay. A little bit of tightness in the traps here. And we're going through that thoracic spine now. Good. Let me know if anything is, anything tender, anything like that. So going from that thoracic, that upper back, that mid back, now we're coming into that upper lumbar and the lower back region. Any issues with this?
No, sir.
Good. Any pain over that right SI joint?
No, sir.
Any pain directly over the sacrum?
No.
And any issues over the left side?
No, sir.
Good. So let's come down all the way here. We want to check the leg length. So we're going to bring the feet together. Now as you can see, he's pulling right short on this side. You can even tell just with the ankles and everything. So this is going to be one thing that we're going to address, especially at the end. When I scan up his body, everything is looking pretty level, which is a good thing. So, yeah, so let's go ahead. What I want to do, I want to just relax Some of the muscles running through here kind of follow the trap going down, just because you are holding a little bit of tension in these areas. That's going to be just one of the main things to start off with. One question I do want to ask you before we go and get started. I know you said that you were having headaches and migraines. Are you currently having one?
Not right now.
Not right now. Okay. When was the last one?
I would probably say 2 nights ago.
2 nights ago. Okay. And then how long do they last for typically?
Usually until after a good sleep.
Okay. All right. So it could be like an all day.
Yep.
Okay. All right. So let's go ahead. We're going to pull out the hypervolt. We want to relax these muscles first before we go ahead and make that adjustment. The reason I like doing it is not only does it, obviously feel good for the patient, but it relaxes the body. It makes the adjustment easier for me, and then also it allows his body to hold the adjustment for a longer period of time. There we go. How'd that feel?
Pretty good. I might need to get one of those.
I do kind of get reactions like that quite a bit. A lot of people don't realize just how powerful that portable device is. I mean, it really is, such an amazing device. I definitely recommend that to anybody. But all right, let's go ahead. We're going to start off with the adjustment. How I like to start is right up at that cervical thoracic junction. Okay. So we're going to start a little bit lower. T2 on the left here. Good. And we had a T1 on the right. Perfect. You just feel how that pressure gets released up the nerves.
Yes, sir.
Yeah, so the reason I love doing that, it just opens everything up, and I mean when that pressure gets released, it's a big release even for you. It's one thing I know patients notice quite a bit. Okay, I'm going to have you take a deep breath in and exhale all the way out. Good. We're going to drop down just a little bit here. One more time, deep breath in and exhale out. Good. Okay. So now what we've done that cervical thoracic adjustment. We did an upper back, that upper thoracic adjustment. I want to come down here. Let's see if there's any change in that leg length. So actually, now originally the right leg was short. It's almost pulling even a little bit longer now. Not by much, but it's almost pulling longer. So now the left leg is even looking short. So what I want to see if that's actually maybe more of a lumbar involvement, more of a sacral or SI joint involvement. So what we're going to do, we're going to stabilize on the sacrum. I want you to raise this right leg up as high as you can for me. Any pain, tenderness, tightness with that?
No.
All right, relax that side. Raise the left side for me. Any pain, tenderness, tightness?
No.
Nope. And to be honest, when I was watching the legs go up, they both went up very smoothly, very easily. So that's telling me that it's not an issue with the sacrum. So what I want you to do, I'm going to have you lay on your side and face me this way. Gonna bring that up. Good. So I'm going to bend this top leg. Just like that. There we go. Perfect. Flip to the other side. Good. Perfect. Lay flat on your back for me. There we go. Got a lot of good release with that. Okay. So now what I'm going to do, I'm going to do a leg pull. With the leg pull, you may feel a release in the ankle and the knee going all the way up to the hip as well, okay? Good. Alright, I'm going to have you sit on up. Okay, and I'm going to have you come forward. Have you stand right here for me. Okay. I'm going to have you bring your arms out by your side. I'm going to have you come up and over mine. Good. I'm going to lean you back onto me. Squeeze your elbows together. There we go. That helped unlock. Because I know a lot of your issues are just right up through here. So I want to do as much as I can through that cervical thoracic junction here. Alright, we're going to come back here. I'm going to have you take a seat for me again. And I just want to make sure that we cleared out the thoracic spine. When I say cleared out, the reason I say cleared out is I want to make sure that there's no pressure on the nerves or the least amount possible. As you guys can tell, I first start off, I do what's called a prone, face down adjustment in the thoracic spine. I just did a standing intercostal adjustment, and then now we're going to do an anterior or a supine thoracic adjustment here. So I'm going to have you give yourself a big hug. Yep. And I'm going to start, I'm going to have you take a deep breath in and exhale out for me. Good. I'm going to come down, come up just a little bit one more time. Deep breath in and exhale out. Good. Okay, so that was already cleared out, which is a good thing. So now what we're going to do, we're going to do the Y-strap. So I know the main reason why people come here is to get that manual decompression. Now you may feel this from that upper cervical spine going all the way down to that low back. Okay. Now is this the first time you've ever had this done?
Yes, sir.
Okay. You are in for a treat today. Now, so adjustment, I'm going to ask you, how did this feel? You know, just be real with everybody. Let them know exactly what you felt and, you know, what they are to expect. So I come up here, I'm going to distract in that y-axis direction here.
Oh.
How did that feel?
Amazing. I feel a couple inches taller already.
Now you felt that go from that, like I said, that upper cervical just going
Yeah, I felt it on the way down.
Perfect, perfect. I'll have you come on up. Good, good. Yeah, so if you were to explain and tell people, if you know, the first time, yeah, you can turn to the camera. What would you tell people if they've never had that done before?
I would say it's worth trying for sure. Definitely feels life-changing already.
You feel how that pressure, I mean, everything, even in the back. Like, I want you to, like, stand up, look down, just kind of move around a bit, kind of go through the range of motion. Do you notice anything different when you first came?
Yeah, I feel a lot less, like, compressed. Like, I feel like moving around's a lot easier for sure.
And especially, I know, like, with you, with being, you know, one, a student, two, you know, you're a wrestler, gamer, so I know, obviously, with wrestling, you know, a ton of activity.
Yeah,
I mean,
for sure.
Just now, you know, it's just one, wanting you to get a better range of motion. Yeah, it's quite a game changer, right?
Yeah, for sure.
Got it. That is the whole point. That's one of the main reasons on why I do that technique. It just literally, it unlocks everything. I always kind of like to give descriptions and examples of what I'm doing. So that strap hooked onto the base of your occiput right here. Mm-hmm. So, you know, you have your curves in the back, and what it's doing is right in through here. These are all the nerves that exit the spine. As you can tell, literally every level from, you know, going C1, going all the way down to your L5. You've got different sets of nerve root, pairs of nerve roots that are coming out each of those segments. What happens over time, you've got gravity that pushes down, or any activity that could throw something out of alignment. You know, a bone could twist, a bone could bend, any way that is causing pressure on these nerves. So when you get that decompression, it literally opens everything up. It takes all the pressure off the nerve roots, and then it just relaxes them. So your body's then able to function and heal as it's intended. So That's one of the main reasons why I do that technique. Just that instant relief, that people get, and especially when you're getting an adjustment. I love doing a little bit. It's a little bit more aggressive of a technique, but the results are, they speak for themselves. I mean, I know, people watch my videos and they watch it specifically for, that Y-strap, and, it's such an amazing move, and that's why I love doing it. And I get great responses from it, so.
For sure.
Perfect.
Thank you.
You're very welcome. Well, I'm Dr. Joseph Cipriano. If anyone is looking to schedule an appointment, just go right to my website, drjosephcipriano.com. Send a message. I typically try to reply within 1 to 2 days, but yeah, I'd love to get you in here. Have a good one, everybody.